My name is Peter Strong. I am a professional psychotherapist based in Boulder, Colorado, and I offer Skype therapy. That is, psychotherapy over Skype for help with anxiety disorders, including generalized anxiety disorder, social anxiety disorder, OCD, driving anxiety, and many other forms of anxiety disorders that respond well to mindfulness therapy. Mindfulness therapy has proven to be incredibly effective for the treatment of both anxiety and depression. It works by getting at the root cause of anxiety and depression. So it's really quite different than conventional talk therapy, which may relieve symptoms for a while by talking about your emotional problems, but talk therapy conventionally doesn't really address the underlying cause for most people. It doesn't allow you to change that underlying cause directly. And the same can be said for medications. They can provide temporary relief of the symptoms of anxiety or depression, but medications will not change the underlying cause of your anxiety or depression. There are other forms of psychotherapy like mindfulness therapy, such as cognitive behavioral therapy. Now, CBT is very good because it attempts to work on the underlying cause in the form of reactive habitual thinking. And CBT is a very good way of helping you identify patterns of reactive thinking and rumination, and then changing them, either by directly inhibiting them before they get established, or by replacing them with more functional, positive thoughts, or by challenging the generalizations and irrational beliefs that we usually become attached to when we're not fully conscious of what is going on in the mind. So CBT has been very successful, and it has been a great advance on traditional talk therapy. Now, mindfulness therapy incorporates CBT and many of the cognitive therapy concepts of CBT, but it takes it a stage further because mindfulness therapy works not just on thoughts, but also on helping you heal and resolve the underlying emotions. So sometimes working on just thoughts is not enough to heal the underlying anxiety or depression. So we need to work on the emotions directly as well. The emotional content becomes habitual also, and it gets triggered in the same way that reactive thinking gets triggered. We have habitual emotional reactions to deal with. And mindfulness therapy is particularly good at helping you identify these emotions and then working with them to promote their healing and resolution. And one of the ways we do this is by actually developing a conscious and friendly and compassionate relationship with these emotions. The aspect of compassion is a very important part of mindfulness therapy, and it's very, very powerful. When you start to develop compassion towards those painful emotions in yourself, that starts to generate your true self, which is not afraid, it's not reactive in nature, but is able to embrace and heal emotional suffering. So that's what we cultivate during mindfulness therapy sessions, learning how to essentially sit with your emotions without becoming reactive, and then responding to your emotions with compassion to help them heal. And very often this involves imagery. We learn to identify the imagery that is causing the emotion, and then we look at changing that imagery in order to heal the emotion. So working with imagery is actually part of the response of compassion to emotional suffering. So this work is quite sophisticated in many ways, but it's quite easy as well. It's natural. It's a natural process that we're using here, because even if you do know psychotherapy, emotions typically will heal themselves over time. And the question is, why do they heal? How does that work? And one of the reasons why they heal is because the imagery of the emotion changes. Often, and very commonly, the emotional imagery becomes smaller in size, and we develop more distance between ourselves and the emotion. So when an emotion changes, its imagery also changes. During mindfulness therapy, we make use of this fact, and we deliberately try to change the imagery and find what works. And this accelerates the rate of healing. So that's an important part of mindfulness therapy, and this is what I offer during these Skype therapy sessions. Skype is a very good medium for psychotherapy online because it allows you to see each other. And as long as you can see each other, then there's really no difference between Skype therapy and conventional therapy in person. So if you'd like to learn more about how to overcome anxiety and depression through Skype therapy and using the techniques of mindfulness therapy that I teach online, then please email me and let's schedule a Skype therapy session at a time that works for you. I see people throughout the USA, also Canada, and Western Europe and the UK, and as far away as Japan and South Korea. All you need is a good internet connection and a computer or even a smartphone, and you can have Skype therapy sessions. So if you'd like to learn more about this exciting approach to working with anxiety or depression or other forms of emotional suffering, then please email me and let's schedule a Skype therapy session. Thank you.